we're still investigating a couple of those. And perhaps of most interest, all of those cases where we've been able to identify a travel history were associated with travel or had been exposed to someone who was traveling. We're still investigating a number of others who, for whom we have not had a chance to find out what their travel history is. We are in the process now of reevaluating the first fatality we had. We take this very seriously when we do have a report of anyone who has died as a result of COVID-19. We are in the process now of reevaluating the test results there. There apparently were some procedural issues with regard to the test. Originally, the test was done by a private laboratory and determined to be inconclusive. And we're wanting to run that test again. And we should have conclusive results on that before the end of today. Because of the importance of these, any death associated with COVID-19, we have developed a policy as of late to require retesting of any sample we've had. We want to be sure the results are accurate. So I'm providing the best information we have at this time, and we will be in the process of reevaluating that one test result. Dr. Park, would you like to add anything to what I've described?
As regarding that death, it was reported to us a couple of days after the death had occurred, and so we are following up with the healthcare facility, providers, family on just making sure that they're aware that regarding the infection control. So far, as we see it, the clinical management did not change, was not affected by whether or not it was COVID-19 or not. And I think that's an important thing for everyone to remember, is that this is a virus. The clinical management for someone with a viral infection is the same, regardless of whether it's COVID-19 or not. It is to rest. It is supportive care. And that means if you have mild illness, staying home, getting rest, getting lots of fluids, keeping your germs to yourself. If you have more severe illness, seeking that.
So, seeing that you are here with us now is very important. That
sorry.
Job you did.
So at any rate, if you have severe illness, to
mute or mute this thing like this.
Excuse me, can you mute, please? Thank you. So if you have severe illness, to call your doctor, especially if you have underlying conditions, medical conditions. If you are an older person, these are the things that we all need to think about as a community, because those persons who are older have underlying illness. They are especially vulnerable, not just to COVID-19, but frankly to flu, to so many other things. We need to protect those people who are vulnerable in our community. So that's all I'd like to say.
Let me add one more thing, Anna. As we investigated this case, we have identified contacts and pursued those just as we would with any other case. We are aggressively looking at each and every case that's reported to us that's possibly COVID-19 related, and would be identifying close contacts, following up with those close contacts and others as well, to be sure that they are in quarantine if they need to be, and notified of their possible exposure to the case. I'm confident that we're doing what we can to assure that happens, irrespective of a final test result.
Okay. Let's take our first question from BigIslandNow.com if you're on the line. Okay, how about MauiNow.com? Okay, let's go to Sherry Bracken at KWWX in Hilo.
No question here.
Okay, thank you, Sherry. Next would be Home Moving Magazine, Robbie. Robbie, you there?
Thank you. You said that. Yeah, I'm here. Can you hear me?
Yep, go ahead.
So the first case, when the private lab did it, it was inconclusive, and so you reran the results the state lab once yesterday and again today. And if I can clarify on that, and then what would you make of the discrepancy and whether that would suggest underreporting or what that might, or what we might take away from that?
The discrepancy with regard to.
Let me rephrase that. And if I
First, the
could,
case was inconclusive.
Okay, so.
Okay, go ahead.
Yeah, so, I mean, I think it highlights that this is not just a simple test. It does require technical skill, it requires high-tech equipment, and so there are going to be, with so many samples being run, there are going to be these few that sometimes give what we call an indeterminate result. And it's so very important, especially when you have a fatality, to be absolutely sure of what's going on with that result. So, as a protocol, we're likely to rerun any specimens that are associated with a fatality just to be absolutely positive. Especially if this is if we have something like this where we have an initial report from the clinical commercial lab as an indeterminate result. So that's the process that we're following right now. And again, because we want to make sure that we are absolutely positive in terms of what the result may be. But again, in terms of the management of the patient, it didn't change anything about how that patient was managed. It doesn't change anything regarding what we do. When we're notified about a result, we make contact with healthcare providers, with persons who may have been affected. We are aggressively at this time producing or pursuing, I should say, contact tracing, so that we make sure, as Dr. Anderson said, that make sure that any person who might be at risk now is appropriately advised and also kept separate from anyone else who might be at risk.
Robbie, this is Bruce. Let me just add to what Dr. Park has said. We reported this case out last night, I think close to 9 o'clock in the evening, immediately after we got the result.
Mm-hmm.
We've had a chance to today reevaluate the results, and we did find an irregularity in the processing of that sample. If we had waited longer, we probably would have seen that. But just to be sure that we got the right result, we do want to run the test again and make sure that this is in fact a positive. Again, it would not have changed in regard to managing the case. The individual died 2 days ago. Obviously, the results would have been irrelevant as it related to how that individual was handled. And I have to emphasize, too, that we've handled the case the same regardless of how this result came back. We have assumed that it was a positive, identified contacts, and pursued that. So we'll know by this evening whether or not that is, in fact, a positive. If it's a negative, of course, we'll let you know. We want to be sure you, of course, have the correct information. So stay tuned on that, and we'll of course, let you know one way or the other. But we do feel that any death, of course, associated with COVID is an important one. And by practice, we're going through this for the first time. We are going to be testing each and every individual who is positive, and if they've passed away, test them again, the sample again, to make sure that we got the right result. Mm-hmm. Just to be sure the reporting is accurate.
Okay, our next question from Hawaii Tribune Herald. Tribune Herald, are you back?
Hi, can you hear me?
Yes.
Hi, and I apologize. I don't know if this is something you guys may have addressed yesterday or not, but was wondering if you think that the governor's actions go far enough to help, flatten this curve, or if maybe these drastic actions have come too late, considering how rapidly the cases have been identified here in the state.
I'm going to start with the answer on that, if I could. At this point in time, we don't have any evidence of community spread, that is widespread community transmission. So I think we've gotten as far as we can ahead of this whole process by imposing those rather extreme measures, requiring people to stay home. And it's to prevent the disease from spreading in our community. The best time to do that is before it becomes widespread, where you can expect your prevention measures to make the most difference. So I believe the governor and the mayors who have imposed these very stringent requirements are acting appropriately, and certainly support everything that they're doing. Each county is different. They all have different issues, and it's understandable that there would be different restrictions in different counties. But the fact is that most of the counties are moving forward with restrictions consistent with what the governor's laid out. I expect we're going to see additional restrictions and controls proposed as time goes on, particularly if there are situations where people are not compliant with what the governor's main message was, which is stay at home, don't spread the disease to others as best you can avoid that, and of course work at home where that's necessary. So we do support 100% what's being done here in Hawaii. I think we're way ahead of most of the country in that regard, and we're certainly on lockstep with what other jurisdictions are doing now and trying to prevent the spread of COVID-19. So far as we know, most of the cases, in fact, all of them we've been able to document have been associated with travelers or others, and the few that we haven't been able to nail down may have been exposed to travelers. So I think we're in a situation that is ideal for implementing these measures. We certainly wouldn't want to go any longer before taking actions as we have.
Well, I do want to add, there was at least one individual that we know was not associated with travel, and it just points to the fact that there is probably some amount of localized community transmission, and all this focus on what our leaders are doing to protect us. I would actually argue that all of us in our community, have a responsibility to take responsibility ourselves for how to protect our community. So it's not just about waiting for our leaders to enact whatever laws or mandates or whatnot, but for all of us to think about how do we protect ourselves, our family, our community. And it is that simple message that we've been trying to get everyone to understand: social distancing, keeping our distance from each other, keeping your germs to yourself, washing your hands, cleaning surfaces on a regular basis. These are all really important measures that can be done and should be done regardless of what our leaders are saying or doing. So I just want to make sure everyone understands that.
Let me finally throw in one last bit. We haven't talked about that today. We have in the past, and that is our Sentinel surveys. We're not only following cases that are reported, we're actually looking to see if there is unreported illness occurring out in the community. We've collected a total of 263 so far. 63 samples so far, and we're going to continue to test. The good news is we haven't seen any evidence of widespread community transmission based on that survey. That survey has been done statewide. We're looking at all age groups, high risk as well as low risk individuals who have respiratory illness that could be COVID-19. So I'm very comfortable or confident that we haven't seen any evidence of widespread transmission. Having said that, it could be that there is some transmission occurring that we haven't been able to identify. And again, this is the time we want to act. This is the time when we want to be together as a community and preventing the spread of that disease. It's going to take each and every one of us to accomplish this, regardless of what the mandates are.
The Maui News, please. Maui News.
Hi, yes. We learned this morning that a Maui Health employee had tested positive for COVID-19. Do you know how the employee became exposed, and are you able to say what facility it was at? I mean, nurses at these facilities are worried and feel like they should know.
Yeah, no, I would note this is not the first healthcare worker we've identified with COVID-19. There have been others. We work immediately with the facility when we identify a healthcare worker. We work with that person who is infected to make sure we're aware of all their work activities. We, again, aggressively pursue any close contacts of these individuals to make sure that they understand, they're advised appropriately, they are aware, and that if they are truly close contacts having prolonged close contact with the individual, that if they need to be in quarantine, they are in quarantine, that they are monitored in collaboration with us and their facility. So I guess what I would say also to the specific co-workers of the individual, that we are working with the facility as well as the individual to make sure we identify all persons that need to be notified, and they are being notified. So if they are not notified, then they should just continue to practice appropriate infection control. That is, if they have a patient that has respiratory symptoms, a cough or a sneeze, that they should make sure to put a mask on that person to protect others from that person, as well as if they have to treat that person, wear the appropriate protective gear, which is a mask plus eye protection covering all their mucous membranes. So those are really important things to note, as well as, by the way, washing your hands. So those are important for everyone to understand.
Healthcare workers are one of the high-risk groups across the country. In fact, there's a disproportionate number of healthcare workers who have been infected. Obviously, they're treating patients day in and day out and potentially exposed. One of the reasons why we're very concerned about the availability of protective equipment is to be sure that our healthcare workforce is not exposed. And in that regard, we need to be sure we're conserving supplies and equipment to be sure that they do have the protection they need to continue to support this need. This is happening across the world, by the way. Doctors, nurses, and others are of course, coming down with COVID-19 in larger numbers than you would expect if you didn't recognize the fact that they are our front line, and they are risking their lives every day to come to work to protect us all.
Okay. Honolulu Civil Beat.
Okay, so can't say what facility was at.
No.
Honolulu Civil Beat.
Okay, thank you.
Hi, this is Eleni with Civil Beat. With Queens Medical, or the Queens Health System, putting out a plea for donations for PPE, specific items did we request from the national stockpile, and how much of each? And did we request any items that would increase testing capacity?
So we requested, the items we requested from the Strategic National Stockpile are primarily to support our healthcare workers, our healthcare facilities, so that they can protect us and as well as protect themselves from infection. So in that request did include the masks, specifically regular medical masks as well as N95 masks. There were a number of other items that were also included. I'm not privy right now to the exact number. I'm sure we can get that data to you as far as what was received. I can tell you that a number of items were received, that the Healthcare Association of Hawaii is working with the healthcare facilities and other providers to make sure that there are those needed, very much needed, precious equipment, personal and protective equipment especially, are distributed to the facilities. But even though we've gotten that Strategic National Stockpile allocation, we need to keep in mind that these commodities are still very precious. We need to help our healthcare workers and our facilities to make sure that we do not contribute to burning through all that needed PPE or personal protective equipment. They are who we're going to be relying on as this pandemic continues to take care of all of us.
By the way, just to let you know, I believe there were 11 pallets of supplies and equipment that arrived and are now being distributed out to all the counties and of course hospital medical facilities there. One of the concerns we have is making sure that the private physicians also have materials and supplies that they need to participate in the prevention of this outbreak, and we're also wanting to be sure that they get what they need. All physicians are dealing with this issue, and they're the front lines for protecting us and identifying cases. So it's not just the hospitals and other medical facilities, long-term care facilities. It is also our private physicians who are in need of these supplies, and we are aware of that and doing our best to be sure that they also have the supplies and equipment they need to continue to operate.
Okay, next, Hawaii Public Radio.
Hi, thanks. So to go back, how many people have non-determined coronavirus results that are hospitalized? as of now? Do we have a number for that? And then if this person who passed away had some kind of underlying disease, why were they not immediately tested locally so that we could get a result within that quick 4 to 6 hour period?
So, and to answer the first question, a reminder that what's reportable to the health department are cases that are suspected to be potentially infected with COVID-19. It is considered urgently notifiable, as well as now that we have the clinical labs up and running, if someone has actually tested positive, that we do require the laboratories as well as the physicians and other healthcare providers to report those to us. So hence, if you think about that, we don't have visibility of every single person out there who's hospitalized with an illness. We only have visibility of those who are reported to us who are either the clinician feels they suspect they have a person with COVID-19 infection or who is positive. Now, that said, our physicians and other providers are very busy. They're put upon. What we are noticing is, frankly, what we notice with every other reportable disease condition is that a lot of times we aren't notified until after the fact when they get a positive result. Right now, the labs are working very closely with us in that they're trying to make sure we're aware of a positive result as soon as the provider is. So we are actually getting that result and then having to then find out more information by and getting in contact with the provider and getting that information. Forget the other one now.
While you're thinking of it, let me. The numbers I have are that out of the 90 or cases that have been confirmed, 6 were hospitalized. Now it's not clear whether they were
right.
They weren't necessarily in the hospital the whole time.
I think she's asking about just all hospitalized, indeterminate, kind of results or something like that. Actually, remind me what your other question was.
Hi, sorry, I got muted. But the other half of that question was if that person had some kind of underlying disease, or they were at high risk and it sounds like they were very sick. Right. Wouldn't they have fit the criteria to be tested locally so that they could have gotten a result within that 4 to 6 hour period?
Yes. So what we're starting to see is, we're starting to see clinicians kind of revert to what's sort of normal practice. They have a patient that they're caring for, and they order the result and order the test, and the test is getting sent to a clinical lab, and that's what normally happens with every other disease, and that's what we're starting to see, and that's probably what happened in this case. Having said that, our labs local labs are actually starting to stand up their own internal capacity, so that I think very, very soon in the next week or so, we're going to start to see that they can run these tests in-house, so to speak, in the state of Hawaii. And I can say, actually, for this particular, if you think about it, the person had their specimen taken on admission. They unfortunately passed away very quickly after that. We were apprised within 2 days, essentially, we were apprised of it within 2 days when the results came out, 2 days after the specimen was collected. That's very fast. That should indicate to you that specimen was actually tested here in the state. So it's demonstrating to you that our clinical labs are slowly coming on board, which is great news. It means that they are starting to not send specimens out to the mainland, and that is awesome news. Essentially, it really means that our testing capacity here in the state to help out clinical providers and their patients it's going to be a reality very soon. But going back to, again, just a reminder that test result or not, whatever the test result is, it doesn't change the clinical management and didn't change the clinical management of the patient, especially underscored by the fact that the result on this test didn't come back for 2-3 days after the patient had already succumbed.
Honolulu Star Advertiser? Star Advertiser? Did we lose you?
Hello?
Okay,
hello?
yes, go ahead.
This is Tim.
Hey, Tim.
My question is the death counted among the 90 cases, and what's up with the changing categories? It's sometimes confusing and makes it seem like the numbers don't add up.
Tim, this is Bruce. Yes, we have assumed that death was one of the cases. Again, that's being reevaluated at this time. But having said that, we are still working on our reporting criteria. Some of the things that the counties asked for would be to designate which of the individuals who was tested or found to be positive in their county was a resident and who was a visitor. Basically, that was a criteria that was asked for.
That actually hasn't happened yet, but the reshaping of the table is really trying to provide you all more clarity, and not just you all, but really the public. Clarity on what is going on in the state of Hawaii. Can I ask you specifically what is confusing to you?
Let me see. The numbers, I don't know where the table is now. I was looking at it. Some of them, you know, there's cases on certain islands, and then you add new cases, and then they don't seem to add up.
Okay, so one thing that you should know, and I think that there's a footnote that notes today that there was noted that there was a duplication of a case count yesterday. So if you added up the new cases, the 14 new cases to yesterday's case count, it will be off by 1. So that's one, but it should be in the footnote.
Okay.
Kauai.
Yeah, I think there was I'm being reminded that there was a discrepancy in the way was reported Kauai versus Hawaii, I think. So there were some things, but we're trying to make sure that the data is complete. We're trying to report it because the counties are all interested in who among their residents were reported as positive. Because we all care about our ohanas, right? So we're trying to present that data as well as presenting, who is a Hawaii resident versus not a Hawaii resident. Tomorrow, I will tell you now, there will be a new row added because we are being apprised of Hawaii residents who may, this always happens with every pandemic, and this happens with every state in that, or outbreak, I should say. There are potential for our residents to be somewhere else and diagnosed somewhere else, so that we'll add a new row in anticipation of that happening as well.
We haven't sent out today's report. As far as I know, we'll double check the numbers before we send something out. We wanted to be sure it was accurate and recognize there was some confusion there. So Dan Dennison and his team here will be double checking the numbers, so at least they're accurate within the categories that may have been reestablished. And
we will also be double checking all of those categories too, because a lot of it's changing day by day. Right about noon each day, new numbers are released on their website. Those are the numbers that we're following. They told us last night that there was a death. Now they're calling it today a potential death. They're saying it's likely to be related to COVID-19, but they're running a third test. A first test inconclusive, a second test presumed positive. They're going to rerun today and have new results, and that's just on one case. What's presumably, or they thought last night, was the first death. They've also resorted and recategorized where people used to be listed per island. Now they're only listing the local residents per island. They've taken all of the tourists down into 2 new rows. We don't know what islands that they're on anymore unless you back up to past days to try to do the math manually. Now all of the tourists are on a separate line, whether they're from the U.S. mainland or from international. The way they're reporting the data is changing by the day. We'll do our best to keep up and help you make sense. We have something very important in that's new from the county of Kauai. The mayor there releasing new guidelines today. This is a 5th mayor's proclamation, giving additional limits. So now here we go into the statewide stay-at-home rule tomorrow. Kauai adding new rules of their own tomorrow, saying for even those handful of types of companies that can stay open, the businesses, the grocery stores, the hardware stores, big boxes or small businesses, they're going to limit on the garden aisle the number of customers allowed inside at a time. So a smaller establishment, only 5 patrons inside, 5 customers at a time, if under 2,500 square feet. That's a fairly small little store. Now you go up in square footage, you can go up in customers, 5, 10, 15, 25. Over 50,000 square feet, that's big. That's a Costco or a Kmart when those were open. Those are large, very large stores, and those, picture that, only 50 people inside at a time. Well, at least it'll help the crowding and any hoarding, at least at one time, inside by limiting those numbers. That includes patrons only. The workers are in addition to that, according to the latest rule. We're going to have a link up this on our website so you can see all the details. Other interesting things in that Kauai proclamation just out this afternoon. We're trying to digest it ourselves. They are officially classifying, of course, motels and hotels, which have been allowed to be open in other county and state declarations. The hotels and motels can stay open, but on Kauai, they're outright discouraging it from having tourists stay in them. So they're trying to state that on the Garden Island, that to the extent that hotels are open, discourage the tourists staying, and their order further limits where they can even go. Also on Kauai, they're going to limit the number of people who can leave your home to go shop at one time to 1. So pick the person who's going to go on the shopping run. It's not a social thing to do anymore. Just 1 person at a time leaving home. Lots of stuff to digest today, folks. We got our whole team on it to bring you the very latest news and analysis on COVID-19 today. Stay with us, beginning with the KHON2 News at 4. We'll have all the details later this afternoon. Thank you for joining us, and as usual, be safe.